Hi, my name is Lacey Millsap, and I'm here to present my project proposal on Medical Associates. It is a company within the Hillsborough community. This is for my capstone project for MHA 650 and my final capstone. So a quick overview of Medical Associates. It is a for-profit group that currently employs about 40 physicians, and they operate at two different facilities in two different locations, the city of Middleborough and the city of Jasper. They currently have services that they provide. They include cardiology, ENT, family medicine, gastroenterology, general surgery, internal medicine, OBGYN, orthopedic surgery, pediatrics, and urology. The issues that are associated with this case, there were 7 of them that needed to be addressed. There is a land option issue where they have a piece of land that they own that they are considering expanding on. They had recently opened up an ambulatory surgery center in the Jasper location, and they are considering opening up an ambulatory surgery center in Middleborough. Their appointment system needs to be updated, and scheduling templates need to be reorganized. Recently, they have been replacing retired registered nurses with medical assistants, so they were looking at a case to see whether this was the correct thing to do. They are also having some internal organizational and management issues, and they were talking about restructuring and maybe changing up a few things. Also, for financial restructuring, the accountants had come up with some new ways to spend their money, and so they were talking about possibly changing the way that they handle their financials. One was to join the area HMO, which is Swift, and kind of merge with them and expand. And then the other one was to restructure their clinical standards and the way that they have physician recruitment for physician retainment. I chose ambulatory surgery for Middleborough. This is my SWOT analysis. So the strength of my rationale for this project was it would be new services for Middleborough. It'd be a really good use of unused space. Currently, they don't have anything happening in the basement of the facility, and it is pretty much just used for storage. So it would make a useful space where they could generate revenue if they opened up the surgery center in the basement. They would increase patient and physician satisfaction. Currently, patients and physicians are having to commute to the Jasper location to have their surgery and perform surgery. And this is just a big inconvenience. You can imagine if you were having to travel to another city to have surgery done because the facility that you go to isn't set up for that surgery. This will also save frustration with physicians where they are no longer going to have to commute to have surgery or to perform surgery, so they can use that time more wisely by treating patients or having additional surgeries. And it will decrease the operating room uses at the local hospital that we're currently using to perform these surgeries. Weaknesses of this case, it would be startup costs of the ASC and physician recruitment. In the beginning, the Jasper location will probably lose patients and revenue, but we will recruit new physicians to replace our physicians from Middleborough that are currently using the operating room time. For the opportunities, it's really about using the space that we have for something functional where we can generate revenue and we can increase patient satisfaction and new services being offered at the facility. Threats of this would be upfront capital of equipment, losing money on investments if it doesn't generate enough revenue, as we saw that the Jasper location has. They've hit their mark for their first year revenue goals. And hiring new physicians, that can always be a little tricky, trying to find somebody to replace other physicians in the area. The rationale of my project is I would recommend using Middleborough and opening up the additional ambulatory surgery center It will definitely increase patient satisfaction since they're no longer having to commute to have surgery done. It's not so much fun having to sit in a car after surgery to drive to your city. And increase patient satisfaction. They will be able to spend more time in the operating room, more times with their patients, and generating more revenue. And my rationale also is that Jasper hit their first year marks of ambulatory surgery and revenue, and I really feel that we can do that here in Middleborough. What questions do you have? Thanks for listening.